Hello, it is such a pleasure to be with all of you and an honor to have the invitation to help kick off this fantastic public health conference in Iowa. I'm sure the only unfortunate circumstance is that you all can't be together just yet, but soon enough, it will definitely come. And I just want to give all kudos to the planning committee for putting on, I think, such a stellar program, a fantastic lineup of speakers. I have no doubt you all are going to be inspired and have some great discussion. And I'm definitely looking forward to that for our discussion here today. My expectation is that I will hopefully give you some considerations to think and elevate your thinking, and to hopefully incorporate and consider recommendations and references that I point out to hopefully bring back to the many levels of important public health work that you do as part of the system here. And I also want to thank all of you for all that you do each and every day to help support our public health infrastructure, which is critical to all of us. So I'm going to go ahead and share my screen, and let's go ahead and get started. What will our children say? In my opinion, continuing to fail them is not an option. And my thinking there is that we have known that we can and need to do much better for children regarding the exposures that they have, and we still have not done that in the year 2021. So we really need to get it together here. My objectives for you today is that you understand the state of children's environmental health in the US, and that you consider the interconnection of climate change, COVID-19, and structural racism upon children, and how that does impact all that's going on, and to identify key actions, recommendations where your leadership is required, in my standpoint, to help protect all children now and into the future, so current and future generations to come. So those that don't know the Children's Environmental Health Network, we're a national nonprofit. We've been working for almost 30 years to protect all children from environmental hazards. And in order to conduct that mission, we have been using the same frame to support the peer-reviewed science. And at times we are a part of the science in the field, in academic partnerships and community-based partnerships, community participatory research projects. Majority of our work is then taking the available science and translating it into action through education, through curriculum, through policy, childhood policy development, child protective policy development, all kinds of opportunities with all different types of stakeholders. And finally, child protective policies at the federal and the state level. Our office is actually right here on Capitol Hill in Washington, DC. So a lot of influence and opportunity on federal policy, bringing the child health voice to every conversation that we can, but certainly we've been providing technical assistance at state policy development, education, action related work for years as well. And I'm very proud to have been working here at the Children's Environmental Health Network for 20 of our almost 30 years. So just for a quick background, just so we're not making any gross assumptions here, we know that children are not little adults. They're most vulnerable to harm from exposure, through their organ systems that are developing, through the metabolism and the that is still functioning, and their neurological systems, their respiratory systems, all are still developing into their toddler years. So making sure that we avoid any unnecessary exposure, especially exposure that we know can harm their young maturing systems, is extremely vital. We do know that while adults may certainly be exposed to these known harmful carcinogens or other chemicals that cause short to long-term harm for a person, usually it's not lifelong damage, because the legacy, the longevity of a child and the years that they have ahead of them is really what also puts them at risk. And we also know that children, sadly, are born pre-polluted. So we know that the first environment is actually mom's womb. So, you know, what mom and even fathers are exposed to early in their life, we now are being shown through an abundance and growing amount of peer-reviewed literature from the National Institutes of Health and beyond, that also, you know, occupational exposure and community exposure, air, water, all the major pathogens, food, are important for all of us for now and into the future as well. Okay, so we know that there are windows of susceptibility to these exposures. So we don't want any child being exposed to known harmful chemicals, but we certainly want to make sure, like I said, prenatal and especially these early development of the fetus. You'll see here in this chart that there's all kinds of different higher risk exposures for different developmental considerations of a young child. And this is, really important. The first 1,000 days, if you will, of a child's life are extremely vulnerable. And of course, they continue to be vulnerable, but those are really, really high risk circumstances. So this is an older graph, but it sadly is still very relevant. These trends that we've seen for the last, since 75, for the last 46 years, developmental disabilities, ADHD, autism, childhood cancers, diabetes, obesity, they're all going in the wrong direction. This is coming from a generation in jeopardy from the Pesticide Action Network, where I'm the proud board chair. And, I wish I could say that we were reversing these or at least slowing them down, but that's not the case. And it just goes and speaks again to our need to be vigilant, urgent, and invest in our children. So what is the general state of children's environmental health? So I'll talk a little bit about national and try to bring in some Iowa perspective as well. We can acknowledge that there's definitely been an increase in the connections between environmental exposures, the health of children, in general, and making that connection. But I would make the case that even in this, biggest public health pandemic that we've all been and continue to live in for the last year or so, it just, I think, continues to frustrate me to no end that we clearly still have a long way to go. There are certain groups of our citizens, at least starting with the US, that still are not making that connection and or refuse to make that connection. That, for example, wearing a mask is not just for me, it's for you and your loved ones, and maybe even perfect strangers that you come in contact with. So just looking at asthma, for example, we know that this is still the #1 chronic illness among children. It's still the #1 reason for school absenteeism when children are, going to be back in the classrooms. And again, if you can't show up, if you're not able to show up, if you can't breathe, you're having trouble focusing like that, it is going to have a short to long-term impact on your educational journey as well. We also know that asthma disproportionately still impacts communities of color, Black, Hispanic, Indigenous communities, and the children living in them. And we know that there are a lot of different things that need to be done to really reverse the course when it comes to childhood asthma. We need to look at environmental justice and really get serious about, again, making sure that we're supporting those communities that continue over and over again to have the biggest burden of harm and risk, and reducing those exposures to pollution, strengthening our clean air policies. Transmission related emissions are a huge part of our air. Outdoor air, which certainly comes into our indoor air. Indoor and outdoor air do need to be considered different for their different nuances. We need to look at, polluting sources and obviously severely reducing that implication for communities. And our responsibility to look at a clean energy economy, which I know this current administration is trying to do. So again, a little bit on asthma, we know that at least by the end of 2018, 7.5% of children under 18 had asthma, and that's just under 6 million children, roughly. In Iowa, by the last year, 6.4 children, according to America's Health Rankings, have been diagnosed with asthma. So just under the national average, but I think we're all steadily, either we're plateauing or every now and again we inch up, we're not going down. And that's the big factor here. And again, a good portion of these diagnosed children are African-American children or other children of color. We also know that there's an annual loss of over 14 million school days. That actually has an economic implication. What about those parents and caregivers that are taking off to have to run the child to a doctor appointment or the ER, which we know a lot of, especially low income communities, kind of use their ER as the way to address a very extreme, asthmatic episode. So again, there's a lot of implications here, economic, education-wise, and of course, health-wise. So air pollutants are a big part of our asthma challenge, but of course, air pollutants relate to other health issues as well. As I mentioned, there's outdoor pollutants we need to consider, and there are also indoor. And those strategies for reducing those exposures may certainly feed into each other, but definitely require individual attention as well. Neurodevelopmental neurobehavioral disorders, again, as you saw in that earlier chart, we are increasing. Learning disabilities by the end of 2019, just under 18% of children, that's about 7 million, so 1 in 5, have a diagnosed learning disability. a good 2/3 of these cases are boys. In Iowa, 9% of 6 to 21-year-olds, where it's 8.4% in the US, have a diagnosed disorder, neurodevelopmental disorder. So almost right in line with the US nation as a whole, a little bit higher. The point for all of us here is this is alarming. There's something happening that has been going on systemically for the last couple decades. We need to get to the heart of it. And many of us in environmental public health, looking at the science available, peer-reviewed literature will tell you environmental contributions and increasing environmental contributions to that are a factor to these rates. ADHD, more than 6.1 million, 10% of children in the US by 2020 are dealing with this disorder, and autism. Prevalence is now at 10% as far as diagnosis. Again, environmental factors certainly may play a role here, and that's what the increasing amount of peer-reviewed science is telling us. 25% of our cases, is what we're talking about, at least, maybe more, but at least a quarter. Lead exposure, pesticides, tobacco smoke, trap pollution, methyl mercury. Again, and the equity component here, half of prevalent children are living in 4 times over the poverty level that are dealing with these type of disorders. So again, we're talking about equity, we're talking about injustice, environmental injustice, and we're talking about serious health implications, not just now, but into the future and future generations. Transitioning to childhood cancer, these are all, children's environmental health is just about everywhere. I can make the case that it's connected to just about every important public health factor, but these are some of the areas that we have prioritized and continue to spend a lot of our staff time in. So childhood cancer prevention, there's a whole program I'll talk about a little later, but there are sobering stats here that just over 16,000 children by the end of 2019 have been diagnosed with cancer, and it's the leading cause of death past infancy for children. There's been a steady rise in the incidence for the last 46 years. Every year, the most common forms of leukemia, brain, central nervous, and lymphomas. And the rates of leukemia are highest among Latinx children. So yes, once again, we have an equity component on top of the overall alarming rates and concerns. It's also an economic and social burden, if you will, for all families and communities as these rates increase. Hospitalizations are costing $1 billion, at least that was by 2009, and they're still rising. 1 in 5 families that are living in poverty, again, already dealing with the wealth of challenges living among the poverty level brings, also receive a new diagnosis. So I would say that there's a correlation there between the high-risk injustice exposures when it comes to the environmental contributions to these cancers, as well as those frontline communities. And there's 40% of annual income lost. Okay, so just like asthma, you can, I'm sure, understand and appreciate cancer treatments, all that's needed, the many visits. If a family is able to obtain this type of access to care, it is serious, and it has truly an implication mentally, economically, socially on all involved. Now, childhood cancer survivors, it certainly isn't a walk in the park. We are seeing increase of incidence of childhood cancers, but we're seeing decrease of mortality. So that is a good sign. But anyone who has dealt with cancer, or anyone who has dealt with a child who has had a cancer diagnosis will tell you it's anything close to a walk in the park. You still have long-term implications: cardiac, respiratory, renal disease risk, stroke risk, sleep disturbances, learning difficulties, infertility, other forms of cancer because of the rigorous extreme cancer treatment and all the chemicals involved there. Greater work limitations, more missed days of work in school, greater loss of household productivity. So the simple truth is that the humane, effective, efficient step here is that we want to prevent harm, we want to prevent illness. We definitely, in this case, want to prevent childhood cancer when we can. And I'll talk a little bit about the environmental components there. Perfluoroalkyl substances, PFAS. This is another area of work that we work with in a collaborative nature. These classes of chemicals are found just about everywhere. They're very, they're found, they have legacy to them. They are found in items, years and years after their initial use. And definitely they are known carcinogens. They cause cancer. So there are coalitions, parent groups, and the federal government's getting involved. The CDC, the NIH has an abundant amount of peer-reviewed literature on this for all of us to stand on. And then there's a lot of anecdotal. We know that PFAS materials are found in some food packaging, some takeout packaging. They're found in firefighting foam, and we're seeing increasing cancer rates among firefighters as an example of that occupational exposure. They're man-made chemicals that were made to repel water and oil, so they're seen as being very, helpful in various construction and industrial practices. They're found in carpets, clothing, non-stick pans, paints, cleaning products, food packaging, and PFOA and PFAS are the most studied part of this chemical class. There are large concerns with pregnant women being exposed, as well as children themselves. There are developmental effects, increased cancer risks, as I've said, and fertility concerns, to name a few. So I just want to take a moment here and just acknowledge again this first ever, unprecedented in our lifetime, majority of our lifetime, public health crisis that we continue to live through. COVID-19 and public health has, in general, you cannot separate the two. I think a lot of the US and worldwide public are being educated every day now about what public health means to preventing us getting as bad as things have gotten, and to obviously not follow this playbook into the future as it has played out. As the cases of COVID-19 surge worldwide and threaten to overwhelm life-saving health issues and services, the survival of mothers and children is at great risk. And that's from the Lancet Global Health. That was just May, almost a year ago, 2020. I just want to, acknowledge that while families continue to deal with a lot of stress, anxiety, obviously all of us trying to keep ourselves and our loved ones safe and out of harm's way, then there also are these other implications as far as disruption of potential health services, constrained access to clinics, schools, social workers, water and sanitation, depending on where you are in the world. And of course, the huge economic and I'd say educational impacts and mental health stress that I believe we will unfortunately be dealing with in public health for years, if not generations to come. Climate change. Climate change is a huge part of our children's environmental health portfolio. From where we stand, it is probably the biggest challenge to the field because it then naturally encompasses major routes of exposure. And so we have so many co-benefits if we really do get serious and address our climate change challenges. So we know that the driving forces are many: population growth, urbanization, new industrialization, rapid globalization, pervasive poverty and inequity constantly fuel, this whole paradigm, non-sustainable consumption, and a lot of it, at least in the US, chemical transports and biotechnology. We have ozone depletion, deforestation, forest fires, loss of biodiversity. All of that is combining to environmental degradation. And we know that everyone, every living being, animals included, but certainly our most vulnerable, such as children, are disproportionately suffering the most of the effects now and into the future. And from my standpoint, you just do not hear enough or much about the implications to children and other vulnerable populations. And I will say too that poll after poll continues to show that regardless of political leaning or region of the country, social economic status, the vast majority of Americans, well into the 90th percentile, do believe that climate change is happening and that humans are a big part of the driving nature there. So, some of the very natural barriers that may have been there a few decades before are not there anymore. There may be no greater growing threat facing the world's children and their children than climate change, is what we and many of our board members say very often. Some of the specific angles of the climate crisis that impact children, well, the rising heat index. This is from July 2019, but last summer, 2020, had very similar numbers. I suspect this summer we'll see the same. We have continued to see a varying array of weather patterns and much more dampness, a lot more wet climate type of situations. For example, when we're looking at our agricultural system, you don't want drought circumstances, which I know you all in Iowa can appreciate a lot of the farming that happens in the state, and you definitely don't want and cannot have flooding. Both are detrimental to crops, and obviously that impacts the cycles of food and also the costs of food. Also, we know that climate change makes heat waves hotter and longer. So that then forces the limitation of outdoor time, which is not what we want anyone, especially children, to be doing. Heat stress is very real. Greater exposure to disease-carrying insects, ticks, and mosquitoes, which already put us in harm's way. There's a further establishment of inequity among the solutions. So kind of like a Katrina or any other major disaster, like in the fires that we've seen out in the West the last couple cycles, fire season cycles, which we'll see, unfortunately, again. It's not so easy to just say, oh, just get up and leave. Get up and leave and go where? With what? Do we have enough money to do that? How long are we going to be gone? There are a lot of circumstances where people just are not able to flee like that under crisis, and that creates a huge amount of inequity. And, or if you are able to leave, then what? If you're not working, who's taking care of the children? Rising temperatures and decreased air quality obviously increases with increased heat waves and fires and other circumstances that come along with that, with increases asthma and allergies, which I personally can attest to in general. As our climate continues to change, my allergies, which were very minor in my teenage years and into my 20s, have really increased and ramped up, and they seem to get worse and worse every 6 to 8 months. And of course, as I mentioned, increased food insecurity, which is a risk to all of us. This is a picture of San Juan, Puerto Rico during Hurricane Maria in 2017. I was supposed to leave my husband and I out of that port that year for an anniversary trip, which obviously clearly never happened. But, this is, I think we all can remember, and, Puerto Rico is still trying to emerge out of the multiple devastating hurricanes that they witnessed that year. This is the Paradise, California campfire in 2018. Again, just look at the haze of the air, even the nuance of public health response. Do you close your windows? Do you keep them open? What type of respirator should we, everyone be using? At what point is it okay to go outside and even just take a walk, including your pets? All this guidance continues to be refined. And again, this is not where we want to go. We don't want to make this our norm, responding to these type of climate crises. Rather, we need to be reversing and increasing our resilience so that these devastating implications are not continuing year after year. Now, there are clear disparities even within the climate considerations. Climate change will disrupt economic growth as it continues. I mean, you can just put the price tag on any of these flooding disasters or wildfire disasters or any other major weather events. The price tag to the local region is huge. Extreme weather events and fires are going to happen. They're continuing to happen already. Vector-borne illnesses are increasing. Limited health insurance, maybe our future for certain people. If you already have limited health insurance, it's never enough already. What about other insurances that impact your life as far as your dwelling, your home, rental insurance? I mean, all of this. We will be continuing to see, if things don't change, continued migration to our urban centers. I think it's by 2050. A good over 65% or so of our US population is expected to be living in urban corridors that are already overwhelmed, I would say. We still do not have a lot going on as far as I think there's a lot of challenges still in our built environment circumstances. So what does that look like when it's really overwhelmed and overburdened? Again, this is not the scenario we want to play out. Access at all levels, social welfare access. If you're a family dealing with a child with a learning disability, what happens to that fragmentation of those services during crises like these? What about when your child care center, like now, many of them have had to close, been forced to close, maybe might not reopen. How do you work? How do you work if you don't have quality, affordable, safe childcare or K through 12 school open, if that's where your child went before a certain circumstance? And of course, an abundance of mental health challenges. Mental health is not discussed enough at all in public health. It's starting to be talked about more, but between COVID, between climate, between economic disarray, and fragmentation, families are really suffering out here and will continue to do so, again, if we don't get our act together. So the co-benefits of effective climate strategies, there are many. So it's like a win-win. We improve air quality, which reduces the risk to prevalence of childhood asthma and future respiratory illness. There are, for example, major mass transportation initiatives and incentives happening across the country, no idling policies, clean fuel policies, many incentives for biking and walking to work, redesigning communities so that they are more walkable, accessible, bikeable, encouraging more green space, that type of thing. Reducing our CO2 will decrease plant pollen production intensity and duration, and reduce allergy flare-ups and allergy-induced asthma. We've been hearing a lot about our meat consumption here in the US. Seriously, it is a huge drain on our energy. If we are able to reduce our meat consumption a bit, it could truly have huge implications, improving our air and our water quality, lowering our health risk to heart disease, cancers, high blood pressures, strokes. Plastic production, fossil fuel production is a big part of this challenge, and synthetic fabric use. By reducing that dependency will also have a positive for our economy and our health as well. And community green spaces, energy efficient buildings, retrofitting utility facilities. These are just some of many innovative climate solutions that are being, some of them being actually happening in parts of the country. They need to be leveraged, they need to share best practices, and we need to have other parts of our country that to start and be part of the next generation of our much more resilient climate economic economy. So there are also very definite connections to climate change and COVID-19, which I've been speaking a lot about this year, and children's environmental health. So you see the same inequities displayed in high-risk frontline communities. For example, the high-risk frontline worker more essentially is an essential worker as well, we've all been relying on to get our basic necessities for this last year in particular. So they're put in harm's way by going out and working with the public each and every day, the public, which may or may not be heeding public health advice. Also potentially leaving young children at home, not having maybe a childcare situation to rely on to go to work, and or having children virtual learning at home. We've heard lots of different very desperate situations and stories that families are struggling through. Prevention failure is a huge lesson. So, I say often leadership really matters, right? By calling a major pandemic like this a hoax from the very beginning and not taking it seriously and delaying action, we have had many viruses and we will have many more viruses. The difference here is that we need to contain it, right? When we see serious implications like this, we need to contain it. SARS, MERS, bird flu, these have all been very serious viruses, but they never got to this level, right? There are so many lessons learned in our senior living, in our educational, our schools. We've been a part of a lot of the reopening strategies, which are still in motion. The ventilation systems of our K-12 schools have been a challenge, I'd say, for about half of our public health schools, K-12. So how do we really, not only during crisis, but really invest truly in the buildings that children are spending and the staff a good amount of hours of a day in before a major catastrophe so that we can reduce the implications as much as possible. We will see intensity and frequency and duration of extreme events that jeopardize infection control. Again, all very much relate to high-risk populations already at risk. And again, the frontline workers, which I've talked about. So when we think about the climate crisis, we at Children's Environmental Health Network have been, and a lot of our partners have been extremely inspired by the youth-led climate justice movements that have been happening all over the world. Again, if our younger generations can get it, we certainly, as adults, responsible adults, need to heed their leadership and get serious about action, because they obviously are done and expect that of us and our policy making and our standard setting. Environmental racism is an intrinsic part of this entire set of conversations that we're having. Redlining in our housing industry has caused, generational impacts for certain families, for sure. Institutional structural racism has been a big part of, where certain folks have been able to get jobs, where certain folks, the zip codes that certain families have been able to live in, the type of schools that children have been able to go to, the type of access to healthy food options, within a certain range of a zip code, and on and on. These are all very much connected. So we know that when it comes to climate change, and we've been speaking a lot about this and have been really positioning ourselves to be a leader in the US on children and climate change implications and actions that we need to all be leaning on. There are casualties, there are injuries, there's trauma. So maybe you've been hurt during a disaster related to climate change, or maybe someone that you know or love or that usually cares for you, has, or maybe it's loss of life. That is serious trauma that many times families don't even have the ability to hone in on and focus on while they're still in the middle of responding to a crisis. Morbidity and mortality, heat exposures, as I said earlier, and food and water shortages, just to name a few. So what I believe and what Children's Environmental Health Network believes is missing from a lot of conversations. It is good and positive to see health implications to climate being discussed more and more, because many of us in public health were screaming from the rooftops just not that long ago, where a lot of the climate discussion is around biodiversity and our animals, which is great, and our forests, which is very important. But we also need to be closing that loop and helping all folks understand this is all interrelated. Humans are very much a part of this. So we need urgent focused attention on the implications to children, and to be very honest and transparent about those implications, those connections to short and long-term health of children as well, which are getting a little bit more attention and being written on a little bit more, mental health and trauma connections, so that again, we can be helping those in need right now and hoping again to think about the future in our climate action plans that are all over the country. Our learning environments, I hardly ever hear about, a climate action plan for childcare facilities or K through 12 schools, maybe in the regions that are on the coast, but obviously all of us need to be thinking ahead for the resilience of what we're already seeing. For example, before COVID, we had seen a few fall school openings that had been delayed. And I'm talking about in the Northeast, not the Southeast of our country, due to mold and mildew. That's all related to increased moisture and increased, more rain patterns and things like that, that we are not used to seeing in places like the Northeast. And a variety of inequity realities that we've been discussing. We need to acknowledge the truth. We need to acknowledge the frame of how a lot of these circumstances have made everyone, but especially certain populations, even more vulnerable, and make sure that all populations, especially those children living in those populations, have access to the type of resources and services that would assist them. So Dr. Beverly Wright is the CEO of the Deep South Center for Environmental Justice. Many of you may know her, a fantastic environmental justice leader, important leader for all of us. She has said that communities of color are in double jeopardy from the climate crisis. And she's right there in Louisiana. She was right there in Katrina. She's seen a lot of climate implications in her region and has continued to really lift up what can be done and what needs to be done through the lens of engaging with and prioritizing the needs of the community. We know that populations of color are more likely to live near toxic facilities, so African American and Latinx, and that's just from available mapping, geomapping, and historical data. Also more likely to live on front lines of the climate crisis, where you're seeing a lot of increased flooding, increased heat index, climate-related diseases. Poor communities are less likely to have health insurance and access to medical care. So again, what wasn't talked a lot about for Katrina and other flooding situations is the incredible amount of health implications, with all that standing water and potential bacterial infection and whatnot. So it's not just the immediate, and even when communities are cleaned up, it's the continued aftermath of these type of crisis moments. And the California Water Coalition leader has been noted as saying that the Latinx community members are first to lose their jobs and last to economically recover. So again, this is all data that's been tracked by some labor advocate groups and obviously some public health ones. The implications reach so deep. This is why I keep stressing this is all interconnected. We will not get as far as we need to by just looking at one leverage point. We need to consider all health, economic, and equity solutions together. So transitioning to some other topics, but I know we don't have a whole lot of time here, but there's a lot to say. Lead. You might be surprised that I'm still talking about lead, but it is one of the most, I think, oldest children's environmental health issues we've had to deal with and sadly are still dealing with. And I get really frustrated because I get on my soapbox because there's no new science that needs to come out on lead. We know the major routes of exposure. We know how detrimental it is to creating neurodevelopmental delays, irreversible delays in young brains. And we need the political will to turn the tide here and make sure that no child is exposed to forms of lead poisoning when otherwise can be prevented. So lead is an odorless, colorless, toxic metal found in all these types of routes of exposure: air, water, soil, some consumer products, household dust. Many of the exposures we're dealing with now are due to legacy past contamination that continue to persist in our environment. So, for example, we know that plumbing and, the Flint water crisis, New Jersey, Ohio, I mean, most governors understand it's not a matter of if, it's a matter of when. You will also have a water crisis related to lead exposure because of the old lead piping, millions of miles of old lead piping that's still prevalent in our communities across the country. So the Safe Drinking Water Act in 1986 banned the use of pipes, fittings, and solder containing lead in new plumbing installations, which is great. And we know that lead was taken out of gasoline and paint in the 70s, which is also great for those areas of exposure. But we still know that water containing more than 15 parts per billion of lead is unsafe to drink. And we know that, again, there's still a lot of lead service lines in this country that have to be replaced. We know that dose response, we have seen public health in action by reducing lead in our paint and our gasoline. We saw a direct dose response here between the 70s and 2010, although you'll note that we still have not reduced, the exposure to childhood lead poisoning completely, which is the challenge and the frustration. This slide shows the major sources of lead for infants and toddlers. Remember those windows of susceptibility that I talked about earlier. All children, anyone we want to prevent from being exposed to lead in a consistent way, but especially the youngest of our children. So you'll see in 0 to 6 months, the major routes of exposures to lead are through water and also through dust and soil. And again, it's the chipping paint in a building or a home or a childcare facility or a school. At times kids eat the paint chips or they're inhaling the dust. Those are the major routes of exposure through the old paint. And also in 1 to under 2-year-olds, same thing, it's water, majority in soil. And then you also have food coming into play as they're taking in more solid food. So lead poisoned children may cost the nation as much as $84 billion each year. And that's from Corin Ryan, a health economist that some of us worked with on some of our lead prevention concerns. So again, it's the same story: health, equity, economic implications, whether it's lead, whether it's pesticides, which we'll talk about in a bit, whether it's childhood cancer. Those are the main categories that we need to really consider in all related proposed solutions. What is the equitable way to address this? What is the health prevention strategy? And what are the economic benefits to all? Sources of lead in schools and childcare facilities. So again, paint, there are buildings children go to many hours of the day for learning that were definitely built before the mid-70s. So, there's all kinds of guidance for how to maintain that paint on a regular basis so that you avoid the chipping in the paint, the dust. There's, the legacy gasoline found still in our soils that have leached in different mediums. Industry still does release some lead through industry practices. Again, we've talked about plumbing fixtures, imported products, even cosmetics at times. So the General Accounting Office, GAO, releases reports pretty often on our schools. And there was a report in 2018 where they looked at lead testing of school drinking water and noted that there would be huge benefits from improved federal guidance. So at that time, 41% of school districts serving 12 million students acknowledged that they had not tested for lead on a regular basis the 12 months before completing this survey for this report. 43% of school districts serving 35 million students tested for lead. So of those, 37% found elevated levels and reduced or eliminated lead exposure. And I know that Iowa still struggles with lead prevention among children, as many communities do. So my hope and expectation is that you're heeding some of the guidance as much as possible and trying to do what you can to be advocates for eliminating any lead service lines in the state, which does come with a price tag, but the Lead Service Line Replacement Collaborative, which I'll talk in a minute, does have some resources and case examples that you can lean on. The Pew Health Impact Project a few years ago, released in 2018, released a report on achieving equity in lead poisoning prevention and policymaking. And it offers, I think, a very useful resource for all of us in public health. Again, looks at the economic, health, and equitable implications and some case examples of cities, states that have, that are going in the right direction that could be very valuable to all of us as we're being champions for children and such related solutions in our cities and our states. So pesticides. Pesticides are known carcinogens. They are used to kill the life cycle of a living, quote unquote pest, but that doesn't mean that any animals and humans that come in contact with that formula of chemicals is also not gonna be in harm's way. It's right the contrary, actually. At home in childcare, if pesticides are used on lawns, indoors, gardens, infants and toddlers are their behavior, they're crawling, they're exploring, any traps that are sent, this is all at risk for a child to be exposed on a regular basis. In schools and playgrounds, use of toxic chemicals to control the pests in school and or on playing fields, athletic fields, around playgrounds, this is all very harmful. One example of many is that chlorpyrifos, a very awful pesticide that has been identified even by scientists at the EPA to have the need to be banned, as it is banned in other parts of the world. There are some efforts happening at states levels, but it would be, I think, incredible to have some federal action here that, known pesticides that have definite harm to human health and development, especially our young children, need to not be circulating in our commerce and in use. So just throwing in here, again, environmental injustice, we know that no group of people, regardless of their ethnicity, their social economic class, should suffer disproportionately from environmental health hazards. This is pretty much ingrained in all that we do. It's the foundation of our work and any of our collaborative and partner work. And I would just offer that past examples of probably public health ineffectiveness are very much related to not acknowledging these injustices. Because if you're not acknowledging the highest risk of our communities and what their needs are and the services that they need and the type of solutions that they need to really get ahead, then you're not going to get very far. We know that inequities need to lead to solutions. So here's one paradigm, the top green arrow, of a child in a wealthier family. So they can migrate, move safely around. They can afford to buy different food when prices rise. They can have more access to clean water. Maybe they can have a water filtration system or purchase water, which many of our board members say is just a human right violation, because we should not have to purchase water to gain access to clean, healthy, accessible water. They might have continuous access to their health care for preventive means, as well as treatment, more likely to have access to protection from heat. They're more likely to use coping mechanisms that do not compromise their schooling. But then the child down here in the blue arrow, they are from poorer families. They're not able to migrate and move so easily, as I mentioned with the Katrina example. They suffer poor nutrition when crops fail and food prices increase because maybe their families are not able to adjust to the price hikes. They have limited access to clean, affordable, healthy, accessible water. They can lose access to healthcare, or maybe they never had equitable healthcare, and on and on. So my point for all of us is we need to leverage our thinking and make sure that in public health, we don't fall to the status quo and just only look at one of many levers of implications for healthy children overall. So what can we do? Let's talk more about some actions and some opportunities. So the Children's Environmental Health Network has a variety of resources, and I'll be sure to add some links for you all if that's helpful. We have a blueprint for protecting children's environmental health, an urgent call to action. And this was from 2015, so 6 years ago. But again, I believe the lessons are still very relevant to all of us right now, because it takes a while to kind of change the paradigm shift of how we've been doing things. It's a vision that's used to assist in making economic, public health, and policy cases for children. So it can be used at the state level, it can be used at the city level, the federal level. We could very much consider social determinants of health throughout the entire high-level thinking, and justice and equity. And there's about 6 themes that are highlighted here. Again, they're high level. We give a couple case examples, but it's supposed to be a resource that all of you can lean on as you're thinking about the various ways that you influence public health and children's health. In childcare, we do a lot in this realm. We know that there's roughly over, well, before COVID, 13 million children in some form of childcare daily in this nation, spending up to between 10 hours a day, if not more, and sometimes up to 40 hours a day, 5 days a week. So that amount of exposure is extremely important for all of us to consider and make sure that we're paying attention to. So also childcare and COVID links. Each state has its own set of childcare policies, so that creates a very fragmented system. And as a result, the funding for childcare comes from different sources with different requirements. So it's not a one size fits all. It's not like, even if right now I know money has been placed into childcare in different ways through the relief efforts, but again, getting that where it needs to go, the streamlining of that, the logistics of that will be interesting, because I know even schools have trouble doing that, as fragmentation is definitely found in our school systems as well. Children of color and children from low income families are less likely to attend certain forms of higher level or more higher paying childcare programs that already creates an inequity and even access to related services before kindergarten. Many families don't even have that as an option. There's not enough childcare providers in their region. Many right now this year have left and have been forced to close, and many of childcare providers may be going into other realms of work just to create a livelihood for their families. So we may very well see a gap in an area where we already had a gap of professional need and development. And they're underfunded. The US spends less than 5%, 0.5% of our GDP on childcare, which is far less than most industrialized nations. So we're picking up the pieces is a resource here that I would highly recommend you look at. Childcare Aware of America pulled this together, and they're one of many professional partners we work with that help us understand better the childcare space. So these are just some of the implications before COVID that have only been further exemplified during the COVID pandemic, and we will see the ramifications for years to come if we don't really get serious and focus in and assist in public health with these professional leaders for our children. The Eco Healthy Childcare Program is a program that we established close to 15 years ago. We're extremely proud of this program. It identifies an information gap in current educational licensing and accreditation, which is around environmental health understanding and practice. So we assess where environmental health hazards are most common within and around childcare facilities. We have a lot of, again, the who's who in childcare helping to direct us and guide us as advisors. We focus on center-based and family and Head Start and early Head Start. So just about every facility in the US is of interest to us. And we also include the grounds that childcare facilities are on. So the playgrounds, the yards, the parking lots. We determine free, low-cost recommendations that are realistic and have effective best practices for not only protecting much better the health and safety of the children being served in childcare, but also those usually women. It's a heavily women-dominated profession, many of which are of childbearing age. So you really have an implication to impact the facility where children spend a lot of time, the workers, as well as the families, because as you make changes, the families want to know and understand what changes are being made around the environment that they're leaving their children in each and every day. So we're working to empower and educate these childcare professionals to really serve as change agents, which is something that a little over a decade ago wasn't really happening. We have 11 topics that we prioritize: pest control, air quality, household chemicals, lead, mercury, furniture, carpets, art supplies, plastic toys, arsenic, radon, and garbage and recycling. And we've noted that while we've been doing work in climate change and learning environments in pilot places like Puerto Rico and other parts of the country, we definitely want to make sure that we're elevating the connection to our work to climate as well as we talked about earlier. So we work to protect children and caregivers from harmful environmental toxicants. It's all science-based. We are proud of the fact that we are offering free to low-cost solutions. For example, implementing a no idling policy in front of childcare, especially now where those facilities that are open during COVID, most of them do not have parents coming in and out of the facility to help to contain the building. So you have parents pulling up, dropping off their child or picking up their child, and most are, because I see this in my own 5-year-old's preschool, they're leaving the car on, right? And when the air conditioning's on or the heat is on, and they think that they're doing a service, but all of that exposure many times of the day, especially when the front office is right there and the infant rooms, in our case, in my childcare, is right there, can be a problem. So that doesn't cost anything. It's a behavior change, right? We provide resources, fact sheets, frequently asked questions. There's a checklist. So there's the training side of the program, and then there's an endorsement side. So you fill out the checklist, and all of our materials are in Spanish. You can find it online, or you can request it from us and we'll send it to you. And you have to meet 25 out of the 30 questions in an affirmative way. Some are non-negotiable, like around lead, as far as your practices and procedures in your facility. And you also agree to a pop-up visit when we're able to travel again. We're also working on virtual assessments where we can go in and do an environmental assessment and just make sure that what you've reported is actually happening. And thankfully, we have never really run into any egregious concerns. We tend to find people are motivated to be a part of this program, and they also see the win-win on marketing because we help to market their program. We have a big US map on our site. So parents looking for quality, affordable, accessible childcare that happens to care about reducing chemical and environmental hazard concerns can go and see, which facilities are endorsed in our program in their zip code or in their community. So we provide trainings, technical assistance. We have trainers across the country that utilize our Train the Trainer curriculum and then go out and replicate on our behalf, as well as a variety of webinars that we put on and ways that we keep this community that comes in to our fold up to date. So here's a copy of just the checklist. Again, it's online. We certify the answers through an outside signature that is not a staff member of the facility. Again, they agree to a quality walkthrough. There's a very modest fee for processing that is right in line with anything else that they would do for licensing. And we do also have a virtual online training available as well that we also try to promote. So we're also part of the Choose Safe Places early learning program with Agency for Toxic Substances and Disease Registry, the CDC, that's working to ensure that early childcare and education centers are located where chemical hazards have been considered, addressed, and mitigated to best protect children's health. So, you don't want a situation like in New Jersey a few years back where children start getting sick and then come to find out a childcare facility was built on an old mercury plant. The past use of grounds, the past use of buildings, all very, very important. And we have too many unfortunate situations that potentially could have been avoided or prevented by not considering, how certain areas have been used. So there's some guidance available. Just look at Choose Safe Places for early childcare, if that can be helpful to some of your work. In Iowa, I know that Vision for Iowa's Children works so that every child beginning at birth will be healthy and successful. And this program is working to ensure that young children are healthy and ready to succeed in school, growing up in safe and supportive communities and secure and nurturing families, and have access to secure and nurturing early learning environments. We are so pleased to see a program like this, and I would just encourage that. I didn't have the time to really delve into it before this presentation, but if you didn't know about it, or if you do work with this program, what we always try to do is just make sure that the environmental considerations, maybe it's not everything, but some of the highest priority, lead, pesticide reduction, maybe arsenic, mercury, making sure that some of these considerations are at least acknowledged and a part of the planning so that, again, you're not missing out on a huge set of exposures related to the environment down the road. And that's the website, if that's helpful, earlychildhood.iowa.gov. So we work with a variety of partners. The Environmental Law Institute is one, and they're very good at pulling data together and putting policy reports together. So back in 2015, we pulled together this report with them on environmental exposures in childcare. So it's not a whole exhaustive review, but it is a nice highlight review that offers some case examples of states that are, in our mindsight, going in the right direction, that have some, child protective policies that relate to childcare that may be modeled for other places, even beyond childcare. And we tend to find that those states that already have some related environmental health safety standards on the books tend to be a little easier moving to the next phase. So we wanted to enhance all of our understanding of how existing state laws and regulations address indoor environmental exposures in childcare facilities, and then to highlight non-regulatory initiatives that could be modeled. So I highly encourage you to check that out. That's on our website under the Eco-Healthy Childcare Program and resources. We also did a meeting a couple years back, all focused 2-day meeting in Washington, DC with childcare professionals and K-12 professionals, all focused on lead prevention with the Healthy Schools Network and the Learning Disabilities Association of America. It really boggled, I think, all of our mind to find out that none of these professional leaders had ever been convened or had ever really had the space to think about preventing lead in their learning environments. So this resource is a culmination of what we heard, fantastic recommendations, some of the specific needs from these industry leaders themselves, but clearly lead is still an issue, especially where children spend a good amount of their time in homes and learning environments, and we need to do better addressing those routes of exposures. I spoke a little bit about the Lead Service Line Collaborative. We're a big part of the leadership of this, simply just working to reduce and eliminate all existing lead service lines in this country. And so on that site, that's listed here at the end of the slide, you can find some case examples. We're trying to track how are certain cities and states getting some of these repair and replacements funded. What are some other resources for specific industry leaders like childcare facility, housing, other public health leaders? I think you'll find the website helpful. And if you have other recommendations for us or other case examples, we'd love to hear those as well. Clean Water for All is another collaborative that we are a big part of the leadership, working to ensure that we all have access to safe, healthy, equitable drinking water and recreational water. We see it as a basic human right. There's a dirty water rule, which is trying to reduce the positive of the clean water rule and act. And, we're trying to work on that pretty frequently. And we support a variety of community efforts, understanding communities can best serve as their best leverage point and spokespeople for what is happening in their community and what type of solutions they'd like to see. The Cancer-Free Economy Network is a wonderful effort that we've been working on for a good 6 years now. It's a systems approach to changing the cancer lens paradigm in the US. Instead of only focusing on treatment, which majority of cancer research and efforts do, which is important, we're not negating that, but balancing out the money available and the attention to those preventable cancer situations, as I talked about when we discussed childhood cancer prevention. So there's a report that we put out in September with the American Sustainable Business Council, Max Care Fund, and a variety of other childhood cancer leaders, public health leaders. It's the first of its kind that talks about what is available in the science. We know that childhood cancer routes of exposure are pesticides, emissions, air pollutant emissions from vehicles, and paints and solvents. So it already, even though these are still big exposures, narrows for us in the field where we can continue to invest public policy, invest in research, invest in evidence-based solutions at the community level to reduce the prevention of childhood cancer. We have a Children's Environmental Health Indicators report also on our website. It reviews and discusses indicators to how we're doing. How is Iowa doing? How is the nation doing? And from this report, we started developing state children's environmental health profiles. We'd love to do one for Iowa. So if anyone knows of a small funder or has an interest in partnering with us, it really just depends on how we can just get a little bit of our staff time covered to compile all the available data. We have about 7 complete. Well, we have 6. We're working on California now, which will be our 7th. Those are also available on our website, but we highlight, areas for improvement, but we also always highlight an example of how a state is doing, is a leader in protecting children, because all of those lessons learned are there for every state to look at. And the children's environmental health movement that came out of our blueprint from 2015. Every year, the second Thursday in October, which is Child Health Month, we have coined the day Children's Environmental Health Day. This year, it will be October 14th, 2021. We encourage all of you to become partners. Check out our website. You can upload actions that you do. It's a day of action for and with our youth. A day of assessing our success, even if they're baby steps in the previous year, and reinvigorating and aligning ourselves together to further network, expand our tents, and to be much more effective each and every year for protecting children, sharing our best practices. We also obtain proclamations, city and state proclamations. So if anyone in Iowa would like to approach your governor on our behalf, we have a whole toolkit available, ready to go, a letter that could be used so that we have more and more mayors and governors standing up and creating a Children's Environmental Health Day proclamation, which gives all of you as advocates another tool in your toolbox and resource kit to lean on as you're going and working for various child protective policies, efforts, standards. It's kind of hard, I think, to have a Children's Environmental Health Day proclamation and still have some egregious practices happening in your state for children, right? Finally, I just want to hone in also on equity versus equality. And this is a slide I like a lot from Robert Wood Johnson. The top there is supposed to demonstrate equality. So everyone needed a bike. So a bike was given, but as you can see, not everyone's bike was adequate to their needs. But on the bottom level there, equity is when everyone gets a bike, but the bike is suitable for their needs. I would again stress again, I know I've been saying it a lot, we are always hunger and in need for equitable, economically positively driven and health-based solutions, but we also need to make sure that the solutions are informed by the communities most utilizing as end users our efforts, and making sure that their voices are leading the solution-oriented policy or standard or decision-making, and making sure that everyone has what they need, but how they need it. We know that the route to achieving equity will not be accomplished through treating everyone equal. It will be achieved by treating everyone justly according to their circumstances. That's Paula Dressel at Race Matters Institute. And with that, I'm again so pleased to have been able to share some of these highlights with you all. I look forward to hearing from you. Please do reach out. We're always looking for fantastic partners. And I know some great work happening in Iowa. We'd love to do more with you. So thank you so much.